Hello everyone. In this video, we would like to demonstrate a novel way of dealing with coloboma-related retinal detachment with the use of fibrin glue. There are no financial disclosures. A male child in his young adolescence presented with sudden decrease in vision in the left eye since 5 days post-trauma. He had a history of low vision in his right eye since childhood. The best corrected visual acuity in the left eye was counting fingers close to face. On examination, a total rhegmatogenous retinal detachment along with type 3 coloboma and intercalary membrane detachment was noted. The child was planned for left eye pars plana vitrectomy with endolaser and silicone oil tamponade. Moving on to the surgical video for this patient, 3 23 gauge ports were made 4 mm from the limbus, which was followed up by core vitrectomy. Triamcinolone assisted PVD induction was done and peripheral vitrectomy was performed. Now, because of poor contrast, no break was visible within the area of intercalary membrane and no peripheral breaks were noted. Hence, brilliant blue dye was injected into the subretinal space with a 38 gauge cannula. Using a 38 gauge cannula gives us a self-sealing retinotomy which does not require any laser. This is one of the techniques which can be used to find any occult break in cases where the break is not visible clearly. After the fluid air exchange is switched on, the dye is pushed into the subretinal space and forced out into the vitreous cavity through the break. In our case, we can see the dye leaking from the break within the intercalary membrane. The edges of the break were completely dried off and the retina appeared to have flattened out post-fluid air exchange. Endolaser was done around the edges of the coloboma with lesser intensity burns along the edge close to the disc. Fibrin glue is being injected over the site of the break, the thick and the thin part separately, and a coagulum is seen to be formed over the break. The case was closed under air. During the follow-up, no particular positioning was advised to the patient. On post-operative day 5, the best corrected visual acuity had improved to 2320 and the retina was completely attached, with a small air bubble which could be seen superiorly. During his 5-week follow-up, the best corrected visual acuity had improved to 2050 and the retina had completely attached without the use of any tamponading agent or any particular positioning. Hope you have enjoyed the video and thank you for watching.